That's like pretty amazing. No way. I can actually reach behind me. I'm giving full-on endorsement to this man right here. This doctor's actually has done things for me I've never seen before. It's amazing. Look at that.
There we go. Got him. I got him.
Oh,
we got the surgeon.
This is crazy. Superstar right here.
What's going on out there, YouTube land? Today we are with Beverly Hills famed orthopedic surgeon, Dr. Raj. You've probably seen him on Doctors, you've seen him on ABC, he had a radio show. I mean, the guy has literally been everywhere. Like, if you're in the sports media sphere at all, I mean, he works with the Paul brothers, he's at Anderson Silva, Mel Gibson. I mean, the guy really takes care of the elite and has done so forever. So we're very blessed to be in his office today. We appreciate you having us.
My pleasure.
Yeah.
And it's a pleasure meeting you. I've heard the same about you as well.
Yeah, absolutely. So we're going to do a couple different things today. So Doc has some neck tension, some upper back tension. I'm guessing you probably have arthritis, degenerative disc, C5 through C7.
For most likely, I don't even want to look at it
right
now. I had images years ago, and then I started having PTSD and dreams of it.
Okay.
So I said, I showed it to a spine surgeon, and he goes, "Oh no." So when a spine surgeon, and he's a close friend of mine, says, "Oh no," and then I said, "I'll take care of myself."
You're like, fine.
I don't want surgery.
So we're gonna do some muscle work, work on his traps a little bit. He's gonna tell us a little bit about his journey in medicine, how he's moved it from classically orthopedic surgeon, and he still does quite a bit of it. He's gonna talk to us about some regenerative medicine, and then at the end of it, I'm actually gonna get a needle here, so we're gonna do some peptides. He's gonna talk us through exactly what they do, and then hopefully that'll help my knee out even more from my previous stem cells. So. You ready to rock and roll?
Let's do it.
And then as far as a patient, what therapies have you had before? What works well for you? What doesn't?
For me, actually, flexibility. It's all about stretching. So as a patient, I've realized that when I'm more flexible, I win.
Okay.
When I'm inflexible, your whole basis of your world too. That's when I start having tension. That's when I have nerve compression and pain.
Okay. And then, so you have both AC joints you've separated before?
Yeah, well, I've got labral issues from pitching.
Okay.
Weightlifting, I dislocated the shoulder.
While weightlifting?
Well, it was bad. Basically, I was going against a true weightlifter. I did beat him, but I lost in the end where I had the weights up and then just took my arm out of joint. That was about 7 years ago. Didn't have surgery. Didn't require surgery.
Wow.
Just some regenerative
Did you
injections.
reduce it yourself, or did somebody else reduce it?
I reduced it.
Wow.
Yeah.
A true doctor's doctor. He's like, I got this. Puts it right back in.
And I dislocated my kneecap too.
Doing martial arts? Or
No. I wish
breakdancing?
I wish I had a great story. No, I was on a chair just hanging with my daughter, and I turned towards her, and this is something I was told not to do many times. I let the chair fall back, okay, and then what I did is I clenched. As the chair was falling back, I clenched, pulled myself up, my body weight up, chair fell back more, and in doing so, I fell off the chair and dislocated my knee.
Oof. I thought I was going to hear
quad tendon.
Ooh, man.
Yeah.
I thought it was going to be like I was doing the electric slide. And oof.
I wish I had a good story, but it was one of those stupid stories.
La vida loca, right?
4 months of suffering and a long leg brace and surgery.
Whew. That's a rough comeback. Yeah, because we see you with the short sleeves, man. I was like, I know this guy pumps it out, man. I could tell.
Yeah, I do. I try to keep ahead. Same as you.
Yeah, I just need to stay away from the fat burgers and In-N-Out burgers and all the other stuff when I'm in California,
So I mean, generally tension, traps, also operating too.
Sure.
Being tall. I mean,
how tall are you?
Almost 6'4".
He's a beast.
Yeah.
Yeah.
They say height, you're blessed. In a lot of ways, you're not.
Right.
In a lot of ways, you face longer lever arms, more muscle tension.
Sure.
And
in caveman days, it would be great, right? You'd scare everybody away. You could reach the highest apples.
1,000%.
Fitting on airplanes now in a modern age.
Grab what we wanted, but no.
Yeah, in the OR, now it's a hindrance. They built the world for short people, guys.
Right.
They built it for short people.
So if you're short, be happy.
Yeah.
You won't be injured.
Let's check your range of motion here. So I'm going to have you turn your head to the right all the way, and then to the left all the way. It's harder to go to the right.
Yeah, harder to go to the right for sure.
Does that feel mechanically blocked, or does it feel like muscle tension?
It's more muscle tension.
Okay.
Because when I do active release, I can open it up more.
Okay. And then has your neck on that side been worse since you hurt your shoulder?
My neck's always been that's part of the surgeon, and also bad weightlifting too. So earlier on, just education-wise, when you bench press, when you do weights, don't flex your neck.
Right.
And unfortunately, people with longer necks, you're more susceptible to disc issues. So if I had my traps up to here, I'd have no problems.
Right. Gifts and curses.
Yeah.
But I will say this: some of those guys are that muscle bound. What I found is their disc and joint health isn't always the greatest because they don't ever get near range of motion.
Yeah.
So, if something doesn't move, your body's like, well, let's go ahead and lay some different collagen and some calcium down
100%.
Since it doesn't need to move. So, gifts and curses. So when they get muscle bound, what I find is a lot of times they actually start laying down bone into those joints just because it doesn't move. And it's not from like overuse or trauma, it's from lack of use. So there's a sweet spot in everything, right? So overuse, underuse, neither are good. Moderation.
And you know what? The best athletes in the world are strong and flexible.
Yep. So you got to do both, guys.
Yeah.
And again, like I said, we're radical moderates around here. So when appropriate, find the right therapy, go conservative first. And when you need to, then we go invasive. That's the name of the game.
Yeah. And you know what? I tell my weightlifters, I tell my bodybuilders, mix it with Pilates. Oh, and one good Pilates session a week, where you've got flexibility and core strength, you'll change your whole thing.
I like it. So let's check your range of motion on the shoulders. I'm gonna have you AB duct on the right. Let's go all the way up as far as you can. Not bad. Okay.
Okay.
On the left side. Little hiccup on that side.
I think they're both tight. Like they're both labral impingement. They both have labral issues for sure. The right one was always worse. This one's impingement. I don't doubt it probably has a partial tear, not a full tear.
Sure.
So.
Yeah, at our age, you're going to find those tears if you've been using them, So similar to meniscus, the question is it truly symptomatic? Is it catching? Because that's when it needs to be repaired.
Yeah, and these are like, if we take an MRI of a shoulder, you'll see 10 different problems.
Yep.
It's up to us to decipher what's real, what's not.
Absolutely.
I mean, it's all real, but what's really an issue causing it?
Right. All right, let's do a little muscle testing. Let's go right here.
Okay.
Go and push that arm out to the outside. Any pain there?
No.
Okay, and then push inside. Okay. Let's bring it right here. Hold that thumb up. Resist me. Okay. And it feels like you're using your traps there?
No, actually feels
good on your delt?
Yeah.
Okay. And then let's go.
Okay.
That's uncomfortable?
Yeah.
Yeah. So yeah, definitely some anterior impingement. All right, let's go right here.
Okay.
Go right there. Push out. You're right-handed?
Yeah.
But your left, you feel like your left arm is stronger here, right?
Yeah. I've overcompensated,
So hold.
Yeah.
Okay, and we'll go internal. So that one clears a lot easier, right? You feel that?
Yeah.
Okay. And then let's go here. I'm gonna have you like that and bring your elbows up as high as you can. Yeah, we can already see the defect on the right side.
Yeah, my traps are coming up.
Yeah, and there's definitely some blocking there too on the right shoulder.
Yeah, for sure.
Probably from your injury. Okay. All right, so I'm going to press right there, Doc.
Okay.
So what I want you to do is you're going to tilt your head to the right a little bit. So tell me about your path to medicine, like what made you want to go into medicine, and then also your path. Did you always know you wanted to be an orthopedic surgeon, or was that something you figured out during med school?
That's something I figured out during med school. I've always been into sports, basketball, baseball, volleyball, and I was good at it, but the reality is when I went into medicine, initially I wanted to do pediatrics. Love kids, but I couldn't tolerate sick kids. So I gravitated to something I liked, sports, and one of my mentors was the orthopedic surgeon for the Canadian Olympic team, William Stanish, and I just started following him. And I said, what a better, this is the best combination in the world. I mean, where I can actually operate, use my hands, and also help people and enjoy what I do. So I'm passionate with what I do exactly the same way I can see you are.
So it's something that, like you like to help people reach their maximum potential, and that's something as a surgeon you could immediately do. Whereas opposed to other types of medicine, maybe you're just managing lifestyle or chronic illness. Is that something you think your personality kind of was more into? I
think it's all about prevention here. I think we're in a field, and yourself, myself, where we can actually provide prevention. We can make changes. A lot of physicians, what they do is they provide a treatment. For example, if you have high blood pressure, they'll say to you, try this medication, come back in a year. I want to talk about lifestyle or changing it. So I think you can provide more of a holistic approach. I know you can in orthopedics. And one of my pet peeves is watching my colleagues, and what they would do is, say, okay, we fixed your meniscus tear. Okay. Not telling them, hey, listen, maybe that CrossFit's not the best thing to do. Number two, telling them, hey, maybe your hamstrings are really weak and you've got the slide causing this meniscal issue. Or number three, you're overweight and you're not flexible. There's many different reasons and many different ways to optimize you. So for me, it was just a passion of watching people, because I could tell you, one injury is enough to change your whole lifestyle.
Sure.
One injury is enough to actually cause a cascade of depression, obesity, secondary medical issues, multiple medications. Because I'll talk to patients of mine now and say, I had one guy said 16 years, 4 months, and 3 days ago, I injured my ankle, and that changed my life. And weight-bearing joint, it happens.
Right.
And it's all about staying in the game, because you can look good and feel good for a long, long time if you stay in the game and take care of yourself.
Right. Interesting. And you're Canadian, yeah, originally?
Yeah.
Okay.
I'm born, brought up, raised in Canada. So I was born in a small town in Canada, and I was always a rebel. So, and I came down here on a conference, and I said, I'm going to work in Beverly Hills.
Nice. And how long have you been open here?
15 years now.
15 years. He's been the Beverly Hills doc. You guys have heard of Beverly Hills Ninjas, man.
Yes.
Beverly Hills Orthopedic Surgeon. What's up? So tell us about, so obviously you see a pretty elite client base. Who are some folks that you're really tight with, or you've really been able to help a lot that, they're going to know pretty well?
Let's say on the athlete side, Terrell Owens, Brandon Marshall, and Darius McCreary on the actor side, Kelsey Grammer, Charlie Sheen, Vivica Fox, DePaul, Anderson Silva.
So he really is Hollywood doc.
Yeah.
Do people call you Hollywood?
Yeah, sometimes.
I figured. Like, what's up, Hollywood?
So, yeah, no, actually,
It could be Doc Hollywood.
Doc Hollywood. Not yet. I haven't got that yet. That feels better already.
Less tension on that side so far.
Yeah.
Okay. All right. Cool. So, we were talking earlier too about like specialties, because a lot of people, when they're trying to get into residency, they're trying to figure it out, right? So you said you were interested in peds, and obviously it takes a special type of person to go into that field.
Oh, for sure.
They're dealing with some really serious stuff, and it can really take a toll on your emotions.
Right.
When you started looking at orthopedics, you were never worried or scared about blood? You were... No?
Not at all.
Not at all.
Blood, I mean, I like using my hands, so you've got some beautiful hammers here, which I can appreciate. Added on with my specialty, we got some saws, not chainsaws, but saws. We got screwdrivers, we got plates. I mean, so when you can utilize your hands and you're technically inclined to do such, that's an athlete in a lot of ways, or someone who likes sports, and you can combine that with a medical field where you're gonna have an extreme passion about it. So my whole thing is about turning back time or keeping young, and the reality is, if you take care of yourself, I'm telling you, one injury is enough to set it back. And there's a lot of information out there, and one of my pet peeves is I explained to you about stem cells in a short, brief version about the differences in regenerative and what works, what doesn't work. And we're all in a world of ADHD where we're doing a million things at once. And let's face it, if one treatment fails or two treatments fail, we'll just give up. A lot of people do just give up. They're not going to go to number 10. So the reality is doing the right research and going the right path. I mean, there's many people from all around the world that I've saved on different levels just because they were led down the wrong path.
Right, you wouldn't quit on them?
No.
That's interesting. We got saws, we got screwdrivers. So if anybody wants to watch a horror movie or have an orange juice and vodka, you're going to the wrong clinic.
Yes, I think we should do that one day. Combine our. I have a post-surgical patient. I'll send it to you, and then just combine all the tools that we're using.
Every tool that you got. That's awesome. Okay, so tell us a little about your foray into media. You know, we were talking about, like, I first came across you, I think, on the doctors. Tell me about your media career, because, you know, you're pretty well known. Obviously, you've been on all these top lists. You work with WebMD, and your accolades are pretty, you know, pretty top notch. Tell us about how you got into the media side of things.
Yeah, it stumbled onto me. Actually, being in Beverly Hills, I dealt with a lot of producers, directors, and, you know, at one point, one producer said to me, hey, listen, you should get into this world. He said, you talk well, you understand it, you're passionate, you'd be perfect for it. So one thing led to a second, and next thing you know, I started off directing commercials for Xaralta.
Wow.
I was in videos. I was asked to be like in movies. So I said, you know, it's just the right place, right time. But for me, it was a way to convey the message to a greater population. So we could spread our word. I mean, and it gets only so far, word of mouth.
Right.
But I mean, the avenue you and I have is we can capture this and take it to the whole world and spread this message where people are educated and say, hey, can you help me for this issue? I've had people overseas just see me and then come in, and I've simplified their issue. I had a guy from Boston, outside of Boston, who had an ankle issue, who's ready to have an ankle fusion, okay? 16 years of pain.
And that's a tough surgery to bounce back from.
And
the outcomes are...
It was horrible. I mean, but he saw me actually on one of my media appearances.
Okay.
Came down for an opinion, and because John Hopkins said this, everyone followed the same opinion.
Mm-hmm.
I looked at him, and reality, if I showed you his joint, it wasn't that bad. He was just scarred down with some joint damage. So I scoped him. I did microfracture, and then I did bone marrow derived stem cells.
Okay.
No joke. The next day was the first day he was outside in the parking lot without his cane, and then without his boot, walking around. And it's been 5 years, and he's been pain free.
Wow.
So
that's a great story.
It's just those are stories I get all the time.
Right.
And it's just breaking it down and saying, okay, if someone comes in with this, don't look at what this first person says, no matter what accolades they have. And I respect all my colleagues.
Of course.
But
that's the tricky thing about healthcare, right? Is like, it's easy to follow in consensus because you don't want to be ostracized by your peers, but the goal of public health officials is to take care of the middle part, right? But the goal of the physician is to take care of the individual, and look at them as a unique person.
Yeah, and you know what? If someone, my biggest pet peeves are records, okay?
Right.
I don't want to know what 10 people said about you. I want to know what I think without.
Well, and you're a strong
bias.
enough mind to not bias it, right? But a lot of other people that will, before they even walk into the room, they'll make a decision about what this patient has or hasn't because they're patient X.
Exactly.
And they go in here. I've done it before too. I see the records. I look at it. I'm like, yeah, I think this person needs surgery. They need to have their back operated. Yeah. And I go in and I start doing an exam, and I'm like, wait a second. There's a pelvic fixation, or they actually have piriformis syndrome, and they also just happen to have a disc bulge too, but they're not related. Because when I treat downstream, the symptoms go away, which wouldn't happen if it was coming from the spine, right?
Yeah, I mean, it's incredible. I had a doctor recently who was convinced he was ready to have a hip replacement. I said, you don't need a hip replacement.
Yeah.
I looked at him. I said, you're just tightened up. And I said, your pain is from your ITV band from your disc. Mm-hmm. And lo and behold.
And they can feed into each other, right? Like,
yeah.
Okay, so you have some neurogenic, and then the IT band then yanks into the hip.
1,000%.
Right, and so now you have a secondary mechanical issue that was caused by a primary nerve issue, but that isn't the main cause. If you could take off the second issue, all of a sudden you feel fine, right?
Yeah, and you know what? Lo and behold, he had his epidural. He goes, you're right. I said, yeah. I said, now work on this. I said, now we know our answer. But I said, knock hip replacement out. I said, or you would have had an implant for no reason. And
sure.
How many times do we see that? A lot.
Right. So I'm one of those, actually. So I have probably congenital cam impingement on the hip, pretty severe arthritis, but I get like facet referral from the left side facets, probably L3, 4, 5, and I feel it in this area.
Yeah.
And when I stretch and I move my back and I get it opened up, or sometimes if that open, like if I'm doing reverse hypers,
Yeah.
all of a sudden this just completely goes away.
Wow.
But I feel it, you know.
And it's tight.
Yeah.
So, I mean, the reality is now you got me.
There you go.
So on that level, it's the reality of just breaking it all down.
Sure.
Like what you're doing right now,
Mm-hmm.
okay, is now I can move my neck. I mean, it's just, and are these the hardest traps you've ever felt?
They're pretty rough, man. You're making me work here.
Or are people BSing me about?
No, they're rough, man. They're definitely, especially with me not having a hydraulic table right now. He's making me work. That's for sure. I'm glad the air popped on.
Yeah. No.
So, yeah, back to what we were talking about. You know, one thing that's interesting to me about consensus is, and again, no disrespect, radiologists know their craft better than I do, but one thing that I've realized when teaching report writing and things like that is when they look at specific joints, and orthos too, right?
Yeah.
There's a bias of what you're looking for based on the procedures that are done. So when you're looking at a spine, the first thing people are looking at, spinal canal, right?
Yeah.
And then disc space, and then foraminal space.
Right.
When we look at a knee, what are we looking at? ACL, PCL, meniscus, joint space. When we look at the shoulder, however, we'll look at joint space, but one thing everybody jumps to first is rotator cuff, right? So we're looking at the muscles associated with the shoulder. But you never hear people in the back looking at multifidi thickness.
No,
you don't
not
see
at
that
all.
on a report where you're saying, hey, there would be a fatty infiltration of bilateral multifidi, or
Not at all.
you know, so the description of the report is somewhat based on the types of injuries that we assume we have in those joints. In some joints, we assume muscular related because there isn't neural tissue in the shoulder, there isn't discs.
100%.
So our own biases about injuries also now affect the way we read the radiology
On
reports.
how we treat it too, and this is where you have to take a step back and say, okay, let me listen to you.
Yes.
And you know what?
Does the image match up with the clinical picture, right?
Yeah.
Triangulation.
And if it does, great.
Sure.
Then you go on an approach. If it doesn't, you figure it out.
Exactly. Well, I made this analogy in another video. So we have a lot of patients that have asymptomatic meniscus tears, right?
I'm just amazed in my range now. It's crazy.
It's coming back for us.
Yeah.
So, you know, you have a patient, so me, for example, say I'm going down the stairs, hurts anterior compartment as I
Right.
go down the stairs.
Yeah.
You know, it's chronic, it doesn't lock, it doesn't catch. I get an MRI, we find a meniscus tear in the medial compartment.
Right.
My orthos are negative, I don't have joint line pain. We shouldn't operate on that, right?
No.
Right? But if the dog runs into my knee, pops, it's catching,
Yeah.
right? Positive orthopedic test, MRI also shows meniscus tear. Now we've got an operable procedure.
Right. And guess what? If you have locking, giving way, and the same deal, and a negative MRI, it's an operable.
Right. It's the, yeah, so.
Because MRIs are only about 77% sensitive.
Exactly. So, you know, the clinical picture and the history,
Right.
very important, and sometimes in today's society that gets left out, which I think is very, very, very interesting, especially with spinal issues is something that I find, you know. We're you know, and what I say, 86% of people who have never had back pain have silent disc bulges.
Oh yeah, for
Yeah.
sure.
And then what happens is the psychosomatic effect of accepting our injury as our persona, right?
Yes.
Especially old people, they're like, oh, it's my disc, it's my knee, it's my labrum, and that becomes a part of who they are, their identity.
Well, when they start talking about their labrum, then there's a problem.
Right.
When they start identifying the exact...
Like structures, they're like, yeah, I have
Yeah.
a slap tear on this side, and you're like, well, I think that's become a psychogenic issue now for you, sir. 'Cause
Oh, it's breaking it all down. It's like one of my pet peeves.
you've decided to accept that as who you are as a person,
Yeah.
creating limitations for yourself, you know?
Shit, I'm amazed at how great this guy is. I'm shocked, actually.
Look down for me. Come back up. Go ahead and go down, and back up, and down, and back up, and down, and back up, and down. And you said you're licensed in the Middle East somewhere, right?
Yeah, I'm licensed in the UAE, Dubai.
Okay. And how is it out there?
Great, very sweet people, great facilities, and I enjoyed going to Dubai.
What made you want to do that?
Again, influence from patients and also certain colleagues of mine who went, and then I said, and a little my ADHD. It's a nice it's a nice change, and
So you get bored after a little time and need to create new challenges for yourself. That's
yeah, and it really is like it's a work vacation too.
okay. So you get to go to the beach and drive race cars and
all of that. I mean, it's fun. Dubai is an amazing people, amazing country, and it's nice like going to a 180 culture shift.
Mm-hmm. Yeah, it's definitely not LA.
Yeah.
180 in any way, shape, or form.
So, and being in probably two of the most dynamic cities in the world, it is definitely fun, challenging.
Super clean, I heard over there. Like
Very
no trash.
Very clean, very organized, very safe too. So,
right, I've heard that too.
I'm a huge fan of Dubai. And Beverly Hills, of course.
That's my biggest beef with California, coming from like Vegas, where they do a really good job of keeping the sides of the road clean, everything, and I drive around here and I'm like, they're just going to let trash just pile up on the side over here.
It is crazy here, isn't it?
The most populous, richest state in the country.
And this happens, I know.
Like, come on, clean the roads, guys. What are we doing here? Where are the taxes going?
Yeah, I know.
We've been paying them, I promise. We've been paying a lot.
A lot.
A lot. Let's get some clean roads.
That's actually pretty crazy.
Yeah, definitely getting there. So I'm going to get right within there. I'm going to have you turn your head to the left all the way, and then come back to center, and to the left all the way, and back to center, and again. Let's do about 5 more of those. You'll feel that start to melt off a little bit. Two more. There we go. Good. Starting to come down out of his ears.
No, it is crazy.
Let's go to the right this time. Oh yeah. This is more anterior musculature. Feel that pull to your like jaw and ear?
Yeah. Right here.
Yep. So because you're blocked in the back, those muscles don't stretch on the front. So platysma, CM, and some of the fascia in there gets tight because you just don't stretch it because you can't.
Yeah, so I mean, my whole routine is when I'm symptomatic, what I'll do is just range of motion, then an active release.
With your own hands?
Yeah, with my own hands.
Okay. You got long arms at least.
So yeah,
couldn't do it.
I just hold my arms like this and then
push into it. It's my
pull and
isometrics.
push, yeah.
We'll put it right there too. Good. Okay.
Yeah, I'm cured. Almost cured.
So I'm going to get your upper C-spine here a little bit. So turn your head to the right all the way. I'm going to get you right there. Go ahead and keep turning. Keep going.
Good.
A little further.
This I need a video of.
A little further. Almost around the corner.
No way.
A little further. Good.
That's pretty cool.
All right, let's go left. I'm going to get you right there. And keep turning. Keep going. Those of you know, 80 to 90% of rotation comes from C0 through C2.
Right.
So when we get, myofascial adhesions in there, sometimes all we need is a little bit of vibration and movement to create some extra motion, and then you can keep it with the stretching. Keep going a little further. A little bit more. Perfect. Get back to center.
Jesus.
Getting there.
Very good.
All right, look up to the ceiling for me. And keep going up. Straight up. Keep going straight up. So I'm going to get right under your occiput there. Keep going up. And get to right there too. Same thing. Keep going up. A little more. Right there. Up. Good. All right.
Smile when you get a hammer on you.
That looks
That was
better,
actually. This is crazy, actually. Superstar right here.
Head positioning looks better. You're not as far forward with your head.
No.
Looks like you're more comfortable in that position now. You get a little more right. Right there feels fixated.
Yeah.
So I'm going to slide you right here. What I want you to do is just push your skull straight back.
Okay.
Keep pushing back. A little more. A little more. And lean back with your body too. Good. Okay. Go right again. Not bad.
No, actually not bad at all. Before and after is huge.
Yeah. And I'm going to put you there. Look right again for me. How does that feel when I put your shoulder in that position?
Much better. And I felt the crack in my back.
Yeah. I'm going to reposition the shoulder a little for you too. This is when we're getting that anterior. Yeah.
Yeah, actually that impingement settled a little bit. Yeah, it settled down a bit too.
Yeah, it's not as bad as the first time we did it. Which means, again, feeding forward and back into the musculature in the neck.
1,000%.
Platysma ties in.
Yeah.
So let that arm pull down towards the ground there. And let it drop a little more.
That's pretty cool.
Let it drop a little more.
I gotta get static pictures of this.
There we go. Screenshot some. Okay, go palm forward.
Okay.
So you're gonna turn that hand just still by your side, but bring it down and back.
Okay.
So I'm just getting a little external. Let it hang by your side.
Okay.
Let that really hang down.
Okay.
There we go. And then lean your upper body forward just a tad.
Okay.
A little more. Perfect. Let's go and sit there again.
Okay.
Recheck this internal.
Oh yeah.
Yeah.
Ready to do some weights now.
Yeah. Definitely more clearance in the anterior part. Now it's like the lat's a little tight. So take that arm straight back.
Okay.
And I'm gonna have you keep reaching back with it. Keep going back. Keep going back with it. Really stretch that pec out. A little more. A little more. Perfect. There we go.
Much better.
Yeah, not too bad. And now resist me there. I'm gonna push it down again. How's that on the anterior?
Yeah, a little impingement, but not bad.
Not like it was.
No.
Okay, let's go to right here. I'm gonna do up and down. I'm gonna clear this lower lat. So bring that elbow down towards my side, and then raise it up again. So his body type is very lat centric. Used to do a lot of pull-ups.
Yeah.
Still do.
Yeah.
Still do.
Assisted now.
Okay. And you said pitching. So you play baseball?
Yeah. Remember, we got the Canadian Toronto Blue Jays.
There you go. What part of Canada are you from originally?
Halifax, Nova Scotia.
Okay, you're way out there.
Yeah. So, a little basketball.
Okay. Wait. There's two. There's Nova Scotia and there's one more further out there.
Newfoundland.
Newfoundland. That's right.
Yeah.
Bring it back down. One of my good buddies in grad school was from Nova Scotia.
Yeah.
He went back. Bring it back down. Canadians are always the best students. I think their KP12 system is just significantly better than America's.
Yeah, but
so they're just ready for college. They read at a higher reading level, and I think that probably happens when you have a lower population with more wealth, obviously, comparatively to the U.S.
Oh yeah, I think that's what it said. Even with the healthcare issue, right?
Right.
The socialized healthcare, and this is if it doesn't work for Canada. Population that's 1/10 of the U.S. How's it going to work here?
Right. It's easy to say, but it's never been done at a large population with a very very spread out demographics.
Doesn't make any sense at all. No.
And a population that is lifestyle wise, one of the worst in the world at taking care of themselves. So we just end up chasing chronic instead of exercising, eating real foods, and
no. Canada is a very compliant country.
Sure.
I mean,
comparatively,
in the sense that the government look at the COVID having the closures. It's pretty intense.
Yeah.
Well, they're compliant.
Yeah, exactly. And then you have us over here. We can't get anybody to get vaccinated because everybody's ready to fight over it.
Yeah, there's so many strong opinions out there.
And I understand the fear. I understand the hesitancy. But unfortunately, just like everything else, it's gotten politicized.
Yeah.
There's a lot of things that I agree with these, the people that are in that camp on. I also like low taxes. I also own firearms. I live in a state that's very firearm heavy. But science isn't political. It shouldn't be political. You look at the data.
You're right.
Right? And you make a risk-benefit analysis. And you should talk to your physician before you get it too. I don't think you should be just getting it done at a baseball game. Like, they should know your medical background. There are some people that aren't good candidates for it.
Oh, for sure.
And so they should talk to their physician, have a good discussion with them.
And make it happen.
Yeah, and the vast majority of people should, because you're going to get COVID eventually, right? So it's not going away.
Everyone's going to get it. But it's at a certain point, you mitigate your risk.
Sure. So would you like to get it having antibodies already and ready to roll, or would you like to get it and take your chances with who knows what variant is coming next. It's got 10,000 times the viral load. I would rather have my antibodies, have myself pre-prepared for it, and most people should too.
It's mitigating, right?
Exactly.
It's taking care of yourself.
Right. So if you don't want to take it from the fake doctor, take it from the real doctor.
That's like pretty amazing.
That felt pretty
I
good.
like that.
Yeah. So here, all I'm trying to do is take the medial aspect of the scapula downward to create a little more clearance on the front.
Yeah.
Yeah, that looks better.
Jesus.
Actually,
You need to move to LA.
that rib too. He's like, I need tune-ups, man.
Huh?
He's like, you said you're gonna need tune-ups. He said, I'll trade you out. You get the PRP and the peptides. You come in here and get hammered with me. There we go. That looks better.
Yeah, send me your MRIs for sure on your knee, because I will fix your knee.
For sure. You like that for me? And then push out again.
Okay.
Push out. And then push inward. That feels solid, yeah.
Yeah.
Do this for me. Go in and out a few times right there. That tender?
A little bit, but not crazy.
So go all the way to your belly for me, and then come all the way back up. Yep. About 4 more of those. So did you ever have like a starstruck moment, working with so many celebrities and, coming from a pretty rural place? Was there ever a moment where you met somebody or worked with somebody you were like, dang, I made it, or this is really cool?
You know what? Actually, I would say at first, anything that came to me was a little different.
Pretty surreal, right?
Surreal.
You call mom like, hey,
and then
your son made it.
And, after that I said, oh, this is strange. I'm having drinks with people actually
We're watching on TV.
Or having dinner or friends with, or going with people that I revered and looked up to.
That's awesome.
So, yeah, it's surreal for sure.
Yeah, that's awesome. Come in and live in the American dream, right?
Yeah.
Okay, again. And push up. Pretty solid. Okay, let's bring it right here. Hold. Good. And we'll go inward. Go thumb down one more time here.
Okay.
I'm gonna bring you right here. Do this for me. Go right here and then bring that up to your face.
Okay.
So do that side, now do this side. Yeah, okay. I'm gonna bring you right around the corner here. So try to relax that shoulder if you can. I'm gonna get your coracobrachialis. It's gonna be the first one that I'm actually gonna make him twinge a little bit here.
So I'm still gonna smile.
He's got a good poker face,
I'm
but
gonna smile.
I can tell this coracobrachialis is gonna light him up a little. Look at that.
No, that's perfect.
He's like,
I'm feeling good.
He's like, I'm pretty tan. I don't typically blush, but this one's gonna get him a little bit. Right.
The people
there.
want to see your pain face, Doc.
He's not gonna give it to you.
I can't
He
give
refuses.
I can't give
He
you.
can't do
Darn.
it. I don't blame him. You don't get in
But
this
this is
position
good.
without having a little pride on it,
Yeah, we gotta have pride.
Right
I
there.
always say I'm Canadian.
There you go. Don't you know?
We can handle it.
Although out there, you guys don't have as much of that accent, right?
No, actually,
East?
I did actually when I got here.
Yeah?
Until I was corrected multiple times.
I find it's more like Manitoba that it's really strong.
You're right. Actually, Manitoba, Newfoundland,
Yeah.
where
Alberta, not so much. Same with BC.
in BC, no.
No, it's Seattle basically.
Yeah.
But then French Canada,
we
different animal.
completely different. It was almost its own country. Actually, that's amazing.
They want to be their own country.
It's amazing. Look at that.
There we go.
I can actually reach behind me.
So let's do that one again. Let's see if that feels any. Oh yeah, that's better. Yeah. So I'm gonna get a little more of that one. So when I'm doing myofascial, right? If I'm here, so
Right.
anterior delt, right?
Yeah.
So it's kind of protected. I can't get to the coracobrachialis
Okay.
without extending your shoulder a little bit.
Okay.
And that, obviously it's described
Right.
by the muscle coraco to brachium,
Right.
but that muscle will limit humeral rotation.
Wow.
So it goes from humerus to scapula, right? So if it's really tight, just the ability for the humerus to move relative to the scapula can be impinged. Then you get the secondary mechanical stuff.
I'm giving full-on endorsement to this man right here. This doctor's actually has done things for me I've never seen before.
So I'm not fired yet.
No.
That's good.
Those cracks are amazing.
Yeah, we're getting some movement, that's for sure. Right there. That's where it's tender?
Yeah.
Yeah. And so when I block there, right? So I'm here, and then I create the motion with my elbow.
That's pretty amazing. I'm still smiling. Still smiling.
Still smiling. Okay. So reach back in now.
Okay. Like this? Oh.
Both of them. Yeah. Yeah, not bad.
No, not at all.
Yeah,
nice little scar tissue. Yeah. Love it.
Let's do that one more time. Yeah, quite a bit better.
Jesus. There's no pain.
Yeah, that elbow's
going minimal pain. I mean by pain.
Yep. One more here. So you're going to go in and out like that. Like we were doing before when I had your bicep. Now I'm going to get your subscap.
Okay.
Got him. I got him.
Now and then.
We got the surgeon.
This is perfect.
The guy that's leaning over, operating all day with his elbows tight to his body.
This feels good.
So were you an artist growing up?
Huh?
Or were you an artist? Did you ever build like model cars or draw or anything like that?
And I just helped my dad. You know, he worked on houses a lot.
Okay.
So I mean, I was always good with my hands.
Gotcha. Because what I found is most surgeons that I talked to always did something with their hands. It's a natural gift and inclination, I think.
Yeah. Great at video games, great at hand-eye coordination. So it was easy for me.
Gotcha.
So suddenly, you pick a field in medicine where you don't have, I mean, we have to use our heads, but it's not all cerebral.
Sure.
A lot of it is...
You have to actually be able to do the technical parts too.
Like, the best time for me is no matter how tough the case is the operating room.
Right.
Because that's where...
The skill.
Yeah, that's where it just happens.
Sure.
And that's the most relaxing time for me. What's more challenging is when I go to clinic and I have to have one patient and just listening, and I love doing it, but just deciphering a plan.
Sure.
And then seeing new lives, new faces, probably in and out and switching in and out. But the operating room is zen. I don't even know what I have to do. So I just show up and they say, you got an ACL, you got this, this, and this.
So you would describe it like when Jordan is in the zone or Kobe's in the zone.
Yeah.
And they're just hitting every shot. That's the zen state. You feel like you get in there.
Yeah, that's my most relaxing component.
It's really cool.
And the easiest component. That's the easiest component in my life.
So it's interesting because my treatment is kind of both at the same time.
Right.
So I'm having to communicate while I'm testing things. Right. And so I have to be able to talk and communicate. But as you guys have seen on the videos, a lot of times I'm staring off into space. Right. Because I'm feeling the tissue and I'm also getting into my zen state. So it's an interesting combination of those two things.
Well, it's funny actually when I'm operating, people say, "What type of music do you like?" I really don't need music. I'm just like zen. I don't know what anyone's saying. Like
time just evaporates.
I've got 10 different, for example, something happens here, it's like a shot. Mm-hmm. I got 10 different ways to solve or correct or adjust. So it's just my time where people will talk to me and I don't even know what they're saying. I'm just doing it. Right. And I'm enjoying it, and that's it. And and again, it's psychological. I see success. You see success, you see positivity, you achieve positivity.
Sure.
If you see negativity, feel negativity, then that's the opposite. But you've got to feel positivity.
Makes sense. So speaking of these hands, let's get a little movement in them while we got you here.
Yeah, that's my beautiful first CMC.
Not worn out at all, right?
Jesus. On both sides. What was that? What does that mean?
That's your wrist, yeah.
What was it?
Scaphoid.
Yeah.
That's good, actually. That one needed it. Move that wrist, it should feel more open.
Oh, yeah.
All right, let's go hand on hip like this.
Okay.
So I'm going to pull that elbow straight back. Look at me. Yeah, you can actually reach up there now.
Yeah.
Pull that elbow back. Nice. He's strong there. Let's stand up. I'm going to put both hands on the wall here. I'm going to do a little scapular mount for you. A little lower. Okay. Do some push-ups down into the wall.
Okay.
All the way down if you can.
Yeah.
You can put one foot forward if you want to. So you're just going to go all the way down.
Okay.
So he was doing scapular push-ups. See, you can tell he's a gym bro.
That's what I thought you meant.
So I'm just going to give you some counter strain on your shoulder as we go down. Try to get that scapula to rotate. Keep going. I need the AC to turn on again, right?
Yeah.
You feel it?
I feel it.
And
Building has its own mind.
And overlap them a little bit. I'm gonna bring your elbows down all the way.
Okay.
And then put one foot back and then kind of fall back to me. I'm actually gonna hook you here. Pretty good on that one. Okay.
Oh wow. Nice. I like that.
He's moving.
He's the best.
How you feel? Feel all right?
Excellent. Excellent.
Perfect.
Actually, I'm impressed. Your tools, your mindset, smart guy.
I'm just trying to absorb by osmosis, the legends of the game here.
Hey, we should have our own show.
We should have our own show. Somebody make that happen, actually.
Yeah.
Yeah. The tall guy and the short guy. The guy with the beard and the clean-shaven guy. We'll do it.
Let's make it happen.
All right, and now we're going to do an injection, so stay tuned for that. Okay. All right, Doc, so I was telling you earlier, so I do have some lateral wearing on my patella out here on the outside. I've had a VMO tear on this side, hamstring tear, a little spurring on the inside edge. So I had gone to Columbia earlier this year, gotten some stem cells. Tell us a little bit about, we're going to do some peptides today, yeah?
Right, so one of my favorite peptides, TB500 and BP157. So they're great, they're natural, number one, made in our thymus gland, okay, so we produce this normally. People with higher levels of BP157 or TB500 have reduction in inflammation. It stimulates stem cell function, produces more muscle growth as well as blood supply in an area. So that, as you know, the secret of degradation of a body part is lack of blood supply. So if you have lack of blood supply, you can't replenish that area and you can't repair. So in this case, what it's doing is stimulating those great stem cells you've got inside of your knee from Columbia. And the beauty of it is they're sub-Q injections. So it's a labile in a sense. So a peptide's amino acid chain that's less than 50. So they're very labile in any environmental scenario. So people who say I'm drinking peptides, totally wrong, because our gut will destroy their peptides. So these peptides have to be stored in a fridge, made in a lab, and basically they're shipped to us frozen, and then we take them out of the fridge, mix it with bacteriostatic water, lysinize, and then we inject it in the sub-Q area. So you can't put it on skin because it'll be destroyed by the environment, and you can't ingest it. So peptides should only be injected. We have a separate way I'll talk about at a later date. I can't, in terms of how we can put it via a patch into the skin by protecting with polysaccharides. So that's what a peptide is.
Okay. So I know in the community out there, a lot of people are buying them on the black market and, like you said, drinking them or injecting them into the muscles and things like that. So what you're saying is like none of that's A, going to be very effective, B, it could be dangerous since they're not trained, and C, they need to see an expert to get this done. 1000%.
So where I get my peptides from are CGMP certified labs. That means certified good medical practice. These labs are governed by the FDA. And you can get peptides anywhere online, or you can even order them or go to a store and they'll, somewhere, a black market area, and they'll give you peptides. They'll tell you to drink it, but it's not going to work. So these peptides, you think about your stomach. I mean, all these acids in your stomach, it's gone within a second. These peptides are so labile that if I leave them out in the air or put them on your skin, it'll be destroyed by the environment. So it has to go in the form it is in order to work. And the best explanation for a peptide, TB500, is a chromosome provides a characteristic through a peptide. So in this case, the best example is melanin. Okay, so a chromosome for color produces melanin, and then melanin auto-regulates our body to produce color. And so people now who want tans can get melanin shots, peptide shots, in order to get tans, and it does work. Now, I'm not a proponent of it, I'm not an expert in that, but I'm an expert in TB500 and BP157, where a lot of my athletes use this. It is banned on some sports for performance enhancement, but realistically for the average person, it is just getting you back to normal.
Okay. And then mechanistically, so say for me, for example, I have some obvious cartilage wear, almost 40, my BMI is pretty high, I played a lot of sports. So tell me about like what the mechanism of these peptides are, as far as is it going to grow cartilage, is it going to decrease inflammation, is it going to get blood supply, and then how would that play in with the other cells that I've already had in there?
Okay, so The knee in itself has no blood supply. Our knees have no blood supply, our hips have no blood supply, our inner parts of our shoulders have no blood supply. So the concept of stem cells is when we cut ourselves, hurt ourselves, break our bones, what happens is we have, throughout our blood supply, these cells go into specific areas. These cells become, upon signal, becoming skin, bone, and then we just heal. But in an area of a joint, why we have arthritis is because we have no blood supply. If we had blood supply going through our joints, we'd replenish cartilage tears. So when we have a cut in our cartilage, it stays, aka arthritis. Loss of cartilage is arthritis. So what the peptides are going to do is going to basically put gasoline on that fire. Okay. Send signals to say, increase the blood supply, let's get these cells working.
Gotcha. So that's interesting because part of the mechanism of how our treatments work is by taking tension off of the joint. So particularly the musculotendinous tension. So like, looks like you had Osgood-Schlatter's when you were a kid. So harden into that position. One of the things we do is by taking the tension off the muscle, we decrease that bone change by decreasing the tension. Right. But obviously what we can't do is get into the joint itself. And, cartilage, like you said, is kind of a gift from God and you only get so much of it. So if we can get an early treatment on the quads, the hamstrings and those things, that's great. That'll slow that process down. But once we're to that point of arthritis, there's not a lot that my therapy can do. And that's where we have to integrate and kind of use these, regenerative methods, right?
1,000%. I mean, every one of my treatments, when I work with a client, I have a team, and a team may be an external team, depending. I have a lot of international clients, national clients, so I'll work with their team outside or within, where I'll be the quarterback and say, I'm going to deal with the static issue, and this may be a little more different. Like, for example, you may have arthritis with an active meniscal tear, and with mechanical locking or giving away, and that's where I'm going to come in and say, hey, listen, I'm going to do a scope, and then I'm going to do stem cells as well and correct the tear. Because if you have constant locking and giving away, that inflammation is going to counteract any regenerative capacity the stem cells have. So it's a combination of that approach, and as you say, we use our heads. Both the two of us. We're not just technicians. We're practitioners. We provide our knowledge. When someone comes in for an injection, I don't just inject and send them off. Right. And we both know, or you just don't adjust and send them off. We both know a lot of practitioners who do that, but if you don't have that full-on approach and understanding, you're not going to achieve the success you want to achieve.
Right, makes sense. And so you're classically trained as an orthopedic surgeon, and obviously you still do that, but it seems to me you've taken a much more holistic approach and you're trying to, preserve that joint structure as long as you possibly can, and that's why you moved more towards regenerative medicine. Is that a fair statement for you?
Yeah, I mean, the reality is I do enough knee replacements, joint replacements. There's enough people out there who need it, and everyone who comes into me, if they're actual bone on bone and they're not a candidate for stem cells, I won't book them. I like great results. But if there's someone who needs, and in that case, we could talk about the best joint replacements, the ones that last longer, because people are living a lot longer. But the reality is you want to keep the joints you have for as long as possible. And it's not just pain, okay? It's not coming out of pain. For me, it's about function. So if your lifestyle is decreased and you're not doing what you want to do and it's affecting you internally, that's one of the indications to do something. So it's akin to me saying to someone, like a lot of my orthopedic colleagues will say, hey, listen, if it hurts you, don't do it. That's for me to say to anyone, or you to say to anyone, hey, if your back hurts you, or your knee hurts you, just sit in a wheelchair. Right. Guess what? We're going to be right. So the point is, my goal is no pain, same level of function, and a smile on your face. Just sit right here. You're perfect right now. Okay, so you know what? You should actually send me your MRIs. I'm serious, and I'll fix your whole knee.
Sure. Deal.
Okay. You can roll up your pants. So here's a peptide injection. Okay. Came from the fridge, sent to us in a powdered form, and then we add bacteriostatic water to it. Sub-Q injection. It's like a Botox needle, so it goes into fat.
Can I tell you I have a crippling fear of needles?
I do too.
Okay. I'm just kidding.
I have a crippling fear of hammers.
So he didn't tell me before.
Nah. So you see how tiny this is? So
Uh-huh.
this is, the half-life is about 21 days. The beauty of this is it's going to fire up your stem cells that are already in your knee.
Okay.
It's going to provide blood supply around your knee and reduce inflammation.
Okay.
Now, let's see if you can smile as you're doing this. Okay. It's just distraction. Hitting around the VMOs. It works within an 8 centimeter area, so. Woo! That's it. Woo! Not bad.
A little tender, not gonna lie.
Yeah, it's a little challenge, but it's really gonna
He
help
was
you.
so smooth with it. He was bam, bam, bam. It's like he's done it a million times. Skills. The man's got skills. So, Doc, if they want to book at your clinic, is there a website that people can come to check you out? And then, as far as people, looking to book you for media and stuff, what's your social media where they can find you?
Okay, so my Instagram is at Dr. Raj, DRRAJ. My website is www.drhipandknee.com. That's drhipandknee.com with a DR. And my phone number is 310-247-0466. So, easy. I'm easy to find.
Yeah. So if you're coming from around the world, a lot of people do to come see Doc. So, you can go on there and check that out. And obviously, if you're in the LA area, same thing. You can call the number, get on the website. And I'll let you guys know the follow up on this. I'm pretty excited. I know he's got amazing rave reviews on it. So I'm pretty excited to see how much better my knee feels after this. And then we'll link his website below in the video. Make sure you guys go follow him on Instagram too. There's a lot of cool content out there.
And then also you're going to send me your MRI and then
I will.
I'll have a complete look at your knee and I'll create a plan that will correct this.
Awesome.
You won't have to worry about that.
And I'm going to keep my femur if I can, right?
Yeah. I was,
For as long as I can.
Well, those implants are... I was hiding
this.
this away from you. You won't need this.
Give me 15 years and I'll consider that one.
I love it.
All right, Doc. Thanks again for the hospitality, and make sure to go check him out.